So that's what's interesting. And I probably should record what we're saying because, this interaction with the modern consumer and how they perceive their own body.
It's shifting so fast.
Yeah. And, well, even something like a virus, right? Can a layperson, I'm not a virologist. It's hard for me to even comprehend, well, okay, so this little tiny thing I can't see that they keep showing me pictures of on the TV with all these little bumps and stuff sticking out of it, somehow gets into my body and then somehow attaches itself to my cells and somehow duplicates itself, and then my immune, right? I mean, that's very superficial.
It's microbiology.
It's like,
it's straight. I mean, I'm like, if we want to bring out talking about bacteriophages and how they inject themselves in the cell through their tricuspid, that's a totally different conversation.
wow.
Let's draw that on a whiteboard, which I have actually done with some of my clients because, I have some clients that are germaphobes and they're like, I don't understand this and it's freaking me out. And I'm just like, yeah, this is a very simple way of talking about this. It's very complex, but yeah, it's also but it's also the way that it's in this is another part of my question is I don't have any clients that have confirmed COVID-19, but I was researching the way that why COVID-19 is so lethal compared to other coronaviruses. And it's the way that it's inflaming the lining of the lungs. It's thickening that agent. So it's creating creating more friction in an area that cannot handle friction well due to the nature of the movement. So I was just like, that's going to be intense respiratory screening if someone gets it and they actually survive it. And I'm just thinking ahead, and because it's like, it's not a matter of if, it's when. And it's like, if they're healthy and they're able to survive it, that's going to have an impact on their system. I don't imagine.
For sure, right? Especially if it damages that material permanently, which they're saying it does. Yeah. So that's going to affect an entire cascade or chronological sequence of, oxygen absorption, resorption, getting rid of carbon dioxide. The heart's going to have to work harder now. There's just an entire cardiopulmonary cascade here that's not good, right? And I wonder, the relationship, obviously the immune function of an individual's huge. But those of us with reasonable cardiovascular health, whether that's, you would think it would be pulmonary protective, right?
Yeah, and I was talking to I have a friend who's a physician assistant in the ER, and well, they call it ED. I still keep calling it ER. But he was saying, like, what's really concerning is that he's seeing a lot of young folks getting into the ICU, and they're considered quote unquote healthy. And I'm just like, that's really bizarre to me, because if you have a certain level of cardiovascular health and you don't have any sort of, like, you weren't a smoker, you don't have, like, you haven't had major pulmonary issues, how is it that that's happening? Like, where you're just getting slammed and you're just like on a ventilator for 20 days or something.
It could be, right? Total conjecture that these stressors on the system expose underlying weaknesses that would not otherwise be exposed, and someone might have a genetic immune problem that they just didn't even know until this foreign invader attacks, and the immune system says, shoot, the way that we have to try to counter this is really gonna, hurt you. It's kind of the cure's worse than the
and what's unfortunate too is that, the immune system's just so far behind when it comes to viruses and bacteria, because they multiply so fast. It's like the immune system doesn't even know it's there until it's in larger numbers, where it's like, I need to attack that. So it's like that constant kind of being behind thing. Yeah.
The world's a dangerous place, isn't it?
Yeah, because I think the reality is it's not like we're going to be physically distanced forever.
It's impossible.
I'm just trying to think through, like, how to do this. This is going to be, people are going to come back and we're going to be like, I need to check because you could have been asymptomatic and you may have not have presented anything, but it could still potentially impact your system because it makes you vulnerable, or your system has been kind of messing around trying to fight that, but then other things like different bacterias or pneumonias or whatever can still be affecting you, or the thing that gets you prior or after you have some sort of asymptomaticity to the COVID part. So I'm just trying to think, like, when people come back, how do we mitigate exposure risk and check for that kind of stuff?
Yeah,
That's just
I don't know. Yeah, I wouldn't know. Unless you had a baseline, like a submax screen
yeah.
volume.
For some of my clients that can manage that.
Yeah, for sure. Because, well, again, there's no doubt, again, intermittent hormesis, right, allostasis, moderate amounts of stress are very beneficial
Yes.
system. It's just that figuring out that dose. What does that mean? A moderate amount of stress. It's so relative to the
Especially when you're
existing.
thinking about when you're thinking about the respiratory system, right? Like, it can handle certain amounts of stress, but when I'm thinking about if there's structural damage there, then even if it's minute, it can still be a lot for that area.
That's the
So,
that's the problem. Yeah, without, I don't even know, I have to talk to a respiratory therapist or a cardiopulmonologist to see, how do they really measure, quantify, lung cell health without biopsy.
yeah.
And they're just relying on tidal volume and.
Yeah, I mean, that seems to be the case. Blow into this tube. I mean,
Yeah,
I'm not a respiratory therapist, but that's something I'm curious about, because I mean, we could do spirometry, but that just seems a little bit out of our
well,
scope.
again, it's a very rough, very
It's so,
rough,
yeah,
kind of like some of the stuff we do, very aggregate. It's total pulmonary function, which includes the muscular system, right? And the
exactly.
nervous
Yeah.
system. So, I don't know. It's tricky business. I'll have to look again. I mean, I know the muscle system is part of the endocrine system, and muscle
Yep.
contraction produces all kinds of, myokines and versions of cytokines and interleukin factors, and a variety of powerful chemical mediators that contribute to immune
Yeah,
health. Um,
100%.
and I wonder, if stimulating the respiratory muscles themselves.
Yeah, if it
That's,
could be an indirect way to help the respiratory system.
mhm.
Yeah.
Yeah, access, because I would doubt, again, looking at the tidal volume research, and we really don't access the full
No, that's why I
lung
said
volume,
indirect. It's like we're not really getting in there.
right? So,
Yeah.
teaching someone to access as much of their lung tissue as possible in a
Hmm.
respiratory cycle, right? That's very interesting. I have a device. It's a resistive inhalation exhalation device.
Hmm.
Navy SEALs use it to train
Yeah.
for breath holding and
Yeah,
lung
they also use it
function.
for collapsed lung. When people have a collapsed lung and they're rebuilding that tissue, that they do use those.
Mm.
Yeah.
Forces contraction, right? What
Hmm.
forces the lung tissue to really squeeze hard,
Hmm.
and then maybe it has a resiliency and it expands back out. And look at that some more.
Yeah, that recoil factor is like so important.
To reinflate the lung.
Yeah.
Huh. Huh.
Are we going to think about adding this to the allostatic load? Anything? I mean, this is
Yeah.
just so unprecedented and so
Yeah.
random.
Well, that'd be
And
part of currently diagnosed diseases, right?
yeah,
But
but I
again,
think about the way that
there'd be two diseases now, right? The actual infection itself, and
Mhm.
then lung damage, right? The pulmonary damage would be another disease.
Yeah, because I don't think people think about it that way as like a disease right now.
Mm.
Um,
Yeah,
like,
the
and
consumers, it's tough.
yeah, 'cause
Hopefully they hear the
everyone's in
message.
a high anxiety state right now. They're not really thinking about I don't think they're really thinking about the way it's impacting their body. I think they're thinking about, I don't want to get it. What do I need to do to not get it, kind of thing. So that stimulation of the sympathetic nervous system, that everyone's kind of swimming in these hormones right now. So I'm just thinking about that, like how the body's going to come down from that at some point.
Well, hopefully the population will see, wait a minute, I have to be fitter if I want to be more resilient and more robust, because we're not getting these viruses. They're not going to go away forever. The healthier you are, the more robust your system is. So
yeah, definitely.
Okay. Yeah, but as far as educating your modern customer, I don't know. Other than the message of, as soon as you're medically cleared, let's start exercising again, and maybe focus on your respiratory system.
Mm-hmm.
It's a problem.
Yeah, and like people typically, don't have access to gyms right now, and they don't have equipment in their homes in that way. Have you thought about, like, if you are trying to encourage cardiovascular health right now, like, other than going for a walk and running or riding their bike?
Well, clearly breath hold cycling works.
Yeah, that's true. Yeah, that's a good point.
I mean, there's no doubt about that. So they can cycle breath hold, box breathing. I teach basic box breathing and full exhalation, full inhalation techniques, right? When someone is triggered in the process we have, that's through the thoracic excursion screen or something in their history, I immediately teach them box breathing, and diaphragmatic breathing, and then teach them how to take their diaphragm, through a fuller excursion of inhalation, exhalation, which is interesting and very powerful. To do. So that might be something that you could initiate with people right away, is let's do some box breathing and diaphragmatic breathing and full excursion, full inhalation, full exhalation exercises.
Yeah. I'm gonna write
people will cough, right? I mean, really full exhale, right?
Yeah, that's the other thing. Full exhalation, yeah. Because
that's like pushing air out even when you don't think there's any left.
Exactly. You'll never get that last little.
Yeah, you won't get it, but you just keep pushing. I remember when I did it, it was painful when I first started doing those exercises.
Yeah, it really.
It was like, wow.
Yeah. Okay, cool. I can definitely incorporate those. Yeah, and just trying to think of other ways that people can start doing something, because, yeah, I mean, it's like, obviously, like, I don't want them to be doing these crazy videos and things of that nature.
That's the problem, right? Well, that's the ad. If you want to be an opportunist in the marketplace, do you think it's ethical or not when this is clearing and you just run ads saying, it was great you're exercising while you were at the stay-at-home order, but if you got hurt or you tweak something,
I'm like, we might be getting a lot of injuries in the next few weeks.
Yeah, I mean, they're doing these crazy functional circus act exercise routines, and there's no doubt in my mind some people are being injured and tweaked, or they're finding out, oh man, I didn't know I had this problem until I started doing this. So that's fine.
That's gonna be a hurdle for them to navigate.
Mm-hmm.
One of the questions I did have about, I have some clients who have gone through gender transitions, and one of the things, because that's such, I think I've kind of asked briefly about this, but as far as like, I have some that, they went through that transition prior, and their system, it's just part of their allostatic load, and I take that into account. But one of the things is how to account for, like, the hormonal shifts.
Wow. I think that's where all the action is, right? For sure, right?
And if they're shifting medications, does that mean I should do a new assessment or, at that point to see if it's different than the other or not. I'm trying to think about what that means
Mm.
for their muscular system and if it requires further assessment, or, that's just a piece of the puzzle. Maybe I can't imagine it not shifting things, because I have a client where things shifted and I was like, hey, what's going on? And I go, yeah, I had to change this medication during that process. And I was like, oh, so I just didn't know how to think through that as far as through assessment.
Yeah, I'm not sure. I think that's that's a super niche, right? I mean, that's a
Yeah.
super special situation. I think you should do some writing on that. Is what I'd recommend. I've never seen anything in the literature on exercise for sex transition operations, and let alone long term, because
Yeah.
for female to male, right? We're talking about
Chest
heavy
surgery.
testosterone, growth hormone as well, or
Yeah, typically they have the testosterone where they're placing that on their skin, they're rubbing it on their skin.
okay.
That some go through genital transition, some don't. So there's just all this stuff happening, in this major zone. As far as I'm like, how are we going to change? How are we going to make sure that you can manage through that change without kind of decimating your muscular health?
Yeah, I'd be more concerned probably with the connective tissue and the
Yeah.
bone keeping
Mhm.
up with the change, right? The muscle
Yeah.
tissues change dramatically.
Yeah. It's like they're going through another growth spurt in a way.
Yeah, so the bones and the
Logically.
connective tissues are not they can't keep up with the muscle improvement and contraction capabilities, I don't think.
Yeah.
So that might be the thing there. Going the other way um, is a totally different problem, right?
Yeah.
Because they're taking estrogen
Yeah.
and progesterones.
Yeah.
Um,
At least that's what they've told me.
who manages that? An endocrinologist manages that whole process?
Yeah, so they have quite the team. But
Yeah.
yeah, the endocrinologist is the one mitigating. Like, I think they also, like, just for like refills or whatever, they have their primary physician, but they're not really medic shifting those medications, because it's going through a very specific phases and cycles as they're going through that process. And it's over a long period of time. And so it's just, yeah, like I'm like, do I need to talk to their endocrinologist? Like, how can I um you know tap into what's happening here? Because if I'm
I
seeing changes, then that's where I'm like, okay, is this a temporary change, or is this a shift you're actually trying to create? And this is just a window into that creation of
yeah,
this.
I would immediately suggest reaching out to the endocrinologist, the team.
Yeah.
Again, I would guess the lead would be the endocrinologist.
Yeah, because I've talked to like some of their primary physicians, just to kind of say, hey, this is what we're doing. But I think, like, when I'm seeing something shift like that, like, I don't want to raise alarm, but I also want to say, hey, I'm noticing this.
No, I
It's
think
not
I don't.
normal.
Again, I don't even know. I don't even know if the medical team even thinks about the exercise stimulus and its impact.
Yeah.
They probably think about it like the lay consumer, right? Well, exercise is good for you.
Yeah. Yeah,
Keep
it's true.
exercising, right? Yeah. I mean, we're not expecting a lot of weird stuff to happen
Yeah.
through exercise where there's a sudden change in force output
Yeah.
in either direction, right? Up or down. Uh,
Yeah. But
hmm.
I mean, when you have testosterone, more testosterone in your system, I mean, that's what's happening. I'm like, whoa. Um,
Ah, right. I mean,
Literally, and I'm like, that's normal, right? Like, because obviously, like, that's what it's doing. But I just, yeah, in regards to, um, I think also too, because there's such um, a spotlight on physical appearance in the community, within like the LGBTQ community. My concern is, are the bones, is the integrity of the bones shifting because the muscles are pulling on it faster. But then there's also like the deeper part of the bone, like is that becoming more brittle because of this hormonal shifting so quickly? Like, you know, just trying to get a sense of like, hey, like I know you're excited about this, but let's try to take this one step at a time and see how it's going for your body to maintain it.
Yeah, because I wouldn't understand the cultural effect that they're trying to achieve, or the visual kinesthetic appearance. So I would think female to male, they want to look more muscular, right? More masculine,
Exactly.
obviously.
Yeah.
And male to female, they want to look what, more slender and
Not
more
particularly.
feminine? I mean, what is the
Yeah, I mean, it can be, I mean, it's typically like a personal choice, you know, if they're doing just the chest surgery, or they're doing both, if they're maintaining a transsexual identity versus a
oh,
full female identity. So yeah, like those typically their presentation kind of dictates their muscular health regimen. And so my other concern with that is not, I don't want you to lose muscular tone and health, because there's some sort of shift happening psychologically too, which they're changing. So, and then their expectations change based on social conditioning and that sort of thing. So it's very, I know it's very niche. I was trying to think about, you know, what it means for that person, and how to share, like, hey, like I know your focus, your goal is to the transition itself, but we need to think like you're physically shifting a lot of things physiologically and physically appearance wise. So how do you want to navigate that? How do you want to do that?
yeah.
In a
Yeah,
way
because
that
they have to take the hormonal regimen for the remainder of their lives, right?
exactly. Yeah, they do.
Hmm.
Definitely. So
I think it's a good one. I think it's probably worth it, especially now if you've got some time. You might as well start doing some of the groundwork on that. I'd be happy to help you with that, because I've never even, again, read the Medical Fitness
can't find
Network.
any literature on it.
Yeah, the Medical Fitness Network would love an article on that. They would be gaga, I think, over an article like that. Let alone other exercise professionals who find themselves in
Yeah.
that situation, going, what should I do here? How is this going to work? Versus
Yeah.
just blowing it off and thinking I'm going to treat them like everybody else.
Yeah.
And
Yeah. And I mean, there's also the component of people who are, you know, different gender presenting, but are still, they're still cisgendered, meaning they're still female by birth, but shifting their appearance physically without hormones or anything.
what
And,
ha-
you know, doing
what
all this.
happens to what happens to menses in that situation? So they're essentially, forced amenorrhea.
Yeah.
So I mean that's
It's
got serious side effects for a
this
female.
is what I'm talking about. Yeah,
Right?
because
So
one of the things I was even trying to recognize it, or find literature on, was how the menstrual cycle influences the exercise regimen of in females, and I can't find much. Like, it's
really,
frustrating. Yeah, and maybe I'm just not looking in the right places. I mean, not enough to really expresses like how those shifts are impacting the female, and then how they can train around that whole process. Like, I'm not finding much, and I didn't know if any, I was going to ask you if you'd seen anything or read anything.
I took some continuing ed from ACE on
Yeah.
women's health and exercise, and they mentioned that a little bit, but again, nothing in a scientific way. Do you have access to the NIH database, or do
I
you
do,
know
yeah.
anybody who does? Yeah.
Yeah.
Yeah, the key there is how to structure the search, right?
Yeah, and I think that's what's tricky, because you know, and you know, each woman's their cycle is a little bit different, and but there are some generalities, but like for people who are, you know, premenopausal, postmenopausal, or you know, they're still like young and and moving, and they've got all those hormones really flowing through their systems, but they're going through these fluctuations because of their own psychological understandings of exercise, and not wanting to bulk up or whatever, kind of just trying to figure out how to explain a bit better about like what it
That's,
means.
yeah. So triangulating the hormonal transitions influence on physiology,
Mhm.
normal physiology for female, and then seeing, okay, when that just by itself, without considering transition, what happens when there's disruption in normal menses,
Yeah.
and chronic amenorrhea. And then I bet you there's literature, some stuff I would think on what is the long-term implication of these chronic hormonal hormonal dosages into a system that's genetically trying to stay somewhere else, right?
Yeah, because I think about that homeostatic window.
Well, they're
I'm like,
push. I
they're
mean, talk
pushing it
about pushing it. I mean,
away.
that's pushing it, right?
Yeah.
So the actual genetics is saying, what's happening here? We want to be here and
Yeah.
secrete this chemical profile internally, and then we got all this exogenous chemistry coming in that's
Exactly.
fighting us, trying to stay this way. There's got to be long-term studies that, after 15, 20, 30 years of doing that, where they're seeing somehow it manifest in the aggregate health of that individual. I would be surprised if
Yeah, that's what I'm trying to look for, you
hmm,
know. And I think also too, like I found a lot of research on like amenorrhea and like high performing female athletes and kind of the long term effects for that. Like I feel like there's a plethora of that research out there. But when I think about like I have a client where she's like, yeah, I haven't had a regular period my whole life. It's just been irregular. Sometimes it skips, sometimes it doesn't, and I'm just like, is that just like, is there a way? I've noted, because what she noticed or implicated was, she's like, since I started exercising, I've been with you, like I've been having a more consistent period. And like, like that to me wasn't the surprising part. It was more like, okay, how do we describe that without, being so, the language. I'm just thinking about how to
it makes
over
me wonder
simplify
if it's
it, but
attached to the circadian rhythm somehow.
yeah, and I think I find like, or and I don't know if this is happening for you, but when there's this kind of health education component for the client, there seems to be such a better investment for them. They're like, oh, okay, now I kind of understand that, and then they'll start to kind of inquire more, which I am trying to encourage in, at least in my sessions with my clients. So
Well, considering you're part of the country, um, where that culture is quite large relative to the
yeah.
rest of the population, something tells me if you really dug in there and became an expert in that area, you'd be very busy. Because
Well,
there
I'm just
wouldn't there,
fascinated by it. I'm
there's
really,
no doubt in my mind that you know when those individuals are going through these transitions, are talking to each other about their journey, they're talking about that stuff. They're
yeah.
saying, have you noticed this? Do you
Oh yeah.
notice that? I don't know, some weird stuff's happening with my right. They're talking about it.
Yeah. Yeah. And I think I think they need more support than they're probably getting, even though they have this whole team. But like, how to really conceptualize what's going on to your physiology is, I think, really important.
Yeah, I'd be surprised if when you reach out to endocrinologists, they wouldn't be interested in saying, let me talk about it. Especially if you presented some research, say, hey, I've been doing some basic research on this. Here's what I found. I'd love an opportunity to discuss this with you and
Yeah.
get into this a little bit more, see if they'd be interested in saying, yeah, let's talk about it. I mean, this is the
Yeah, so
purpose of becoming a
would that be more of like an endocrinology? Um, I'm just trying to think about like where, like which fields of study to really maybe pick apart in there.
I
Like,
would start there,
yeah,
because that's everybody's focus, right? From just a medical, it's about the chemistry.
yeah, of
It's
course.
like, we got to change the chemistry.
Yeah.
Okay, here's how we're going to do it. We know that if we do it, too fast in this one direction, we're going to have problems. What problems? Why are
Yeah.
they staging it? That's what I'm curious. Why are they staging it? There's a reason why they're staging it.
Oh yeah, yeah. They're staging it because they're trying to let those actual changes take root and then move to that next. They've just noticed that different oh my God, what's that word? When they, like, they kind of create these layers, or at least that what I've noticed just from like the cycling, the hormonal cycling that they do for the injections or pills or however they're taking their medications. It seems very thoughtful and specific. And I'm like, okay, why at this point, you know, in your physiology are they saying this? Because it's not always the same for everyone. So that's kind of the other part too, that I'm like, why is it different? And
Yeah, they're measuring something, right? So
yeah,
for sure that would be very interesting. I bet you could find some stuff on that. And the endocrinologist might be able to point you in a direction and say,
that's true.
this is
Okay.
where you want to start looking. So yeah, I would get in. I'd be very curious to see what you find there. That's a course.
I know.
We'll put it if
Yeah,
you want. Yeah, we'll put it on the website if you want. You
that'd be
make some
cool.
money. I will promote it on the website. You make some money from it.
Yeah,
Make it a
I'm
continuing ed course.
really fascinated by all this, and I wanna, and I think the thing is, what's great is that we're seeing success. Like I have about 15 trans clients, and they're like, I don't know what we're doing, but this is great. And so I'm like, all right, let's try to dig into this and see what's great about it, and why is it working across this small, very tiny swath of a population that I'm
Hmm.
working with.
Well, again, it's I would argue it's along the lines of what we're
Well,
seeing. Yeah, the neuromuscular, the neuromotor system
I mean, yeah.
is it's just involved in everything, and
It is. Yeah.
and so
Like even recovery rate. Like I have
it's
five
crazy.
clients where I've noticed varying recovery rates based on the dose and response that we're doing with exercise to their surgeries. Obviously that's going to, post their rehab with, they don't even do a lot of rehab with PTs or anything. So they're just out in the world, like exposed with these, post-surgery bodies.
I just had my breasts removed. Oh, I'm
Yeah.
done.
What?
Had my genitalia removed. Okay, we don't have to. What do we do now, right? Yeah.
Yeah. So,
Mm.
well, cool. I appreciate you being open to the conversation. I'm definitely, yeah, I'm going to be exploring this a little bit more, just to kind of get a sense.
Cool.
Yeah. Thank you.
Yep. All right. I may post this if that's okay with you.
Oh, sure.
Okay. Great. All right. Enjoy the rest of your day, Melissa. Nice talking to you.
You too. Take care.